Dear friends, ladies and gentlemen, it is really a great pleasure and honor indeed for me to be here on a very special occasion. And the occasion is Mission Clot Care being launched for the first time in India. And our objective is to discuss about everything possible about the clot care. Right from the thrombolytic therapy, like we use TNK quite often, Eloxim, we use in acute myocardial infarction, we also use in DVT, and also use in pulmonary embolism and in strokes, even the thrombus valves. Then we talk of antiplatelet drugs, right from aspirin to clopidogrel to ticagrelol and to prasugrel. All these drugs are very commonly used. But my focus today is to discuss on not on unfractionated heparin, not on fractionated heparin, but on NOAC. I'm sure you all are very well aware of NOAC. It's a novel oral anticoagulants. I am not talking here on VKA, that is vitamin K antagonist, like warfarin or isocumarin, where we need a lot of monitoring, a check on the INR, as compared to NOAC, which is very safe, effective, and no monitoring is required. And the bleeding tendency is low or almost low. So I think the various NOAC known to us are Apixaban, Dabigatran, Rivaroxaban, and Rivaroxaban. But my focus in this particular talk is to highlight on Rivaroxaban. Like we use very commonly these days Exafib. You are aware of this. And I think there is so much of data in today's era of COVID. We use in COVID infected coagulopathy and all other coagulopathies, in atrial fibrillation, in DVT, pulmonary embolism, even patient having cardiomyopathy, hypertrophic cardiomyopathy, any cause of atrial fibrillation, we need this drug. And recently, you all are aware that a drug like Rivaroxaban is very commonly used in so-called CCS, a chronic coronary syndrome. And a new indication is also coming up or emerging. It is in the carotid artery disease. If you are aware of the COMPASS trial, they use 2.5 mg BD, low dose, long term, no side effect. So a lot of data is available with a logistic information that this is the drug of choice. We can use with aspirin what is called as DPIT, dual pathway inhibition therapy, and not DIPT. So most important is not monotherapy and not double therapy, but dual pathway therapy is the answer. And the component of the treatment there are Rivaroxaban and low dose aspirin. And COMPASS trial has given us a lot of information. We should do it in all the patients of CCS. I'm sure you know the definition of CCS and the classification of CCS by European Society of Cardiology. Any patient who has got ACS, chronic coronary syndrome, syndrome X, post PCI, heart failure, new onset, or a microvascular angina, they all come in this category where we should use it very often. Second thing I want to talk to you about atrial fibrillation. Non-valvular atrial fibrillation, this is a common indication. And I'm sure you are aware of a lot of studies like RELY study, Aristotle study, or ENGAGE study, or even the data which is available from so-called ROCKET study has shown very clearly the benefits, mortality benefit and morbidity benefits of NOAC and atrial fibrillation. This is the drug of choice. Rivaroxaban is a super factor 10A antagonist. This is a very important parameter which I am talking to. And this is the only drug which is very effective, and we have seen in all the patients of COVID coagulopathy as well as non-COVID coagulopathy where this can be used. And then in the patient with DVT and in the patient with pulmonary embolism. A lot of data is available with the Einstein studies, as well as we see in so-called empirical study, and it has shown very clearly that we have to give it for a little long time. So Rivaroxaban is the drug of choice in ACS, in CCS, in a patient of atrial fibrillation, non-valvular. But nowadays, the indication has come even in valvular, in rheumatic heart disease, with mild mitral stenosis, with moderate mitral stenosis, with atrial fibrillation. We don't use VKA at all. It is the NOAC we commonly use. So the message is very clear today that NOAC is a drug of first choice, and out of NOAC, Rivaroxaban is a drug of choice to be used in COVID-infected coagulopathy and non-COVID infused coagulopathy, with atrial fibrillation, without atrial fibrillation, valvular or non-valvular. But what is the black box warning? The black box warning is not to be used in metallic valve. Similarly, we should not use in pregnancy, lactation, or in any malignancy, or in the EGFR in less than 15. Thank you very much for giving me this honor.